So we're doing pretty good. We're normalizing, and we continue to ask our people to remain vigilant. We continue to ask those who are not vaccinated to get vaccinated. I mean, even though, as I said, I'm not as optimistic about achieving that 70%, we continue to spread the public education and encouraging people to get vaccinated. This is the best way to protect yourself against COVID. And again, even though the strain here is relatively mild, it can be far more impactful in individuals with certain ailments. And sometimes to even healthy people, they tend not to cope that well with COVID. So the best thing to do, the safest thing to do is to be vaccinated. So we're encouraging those who aren't vaccinated to get vaccinated. Now, we would have lifted the requirement for wearing masks. But I have to tell you, I mean, practically everywhere I go, I see people still wearing a mask. In the offices, the supermarkets. I went to the supermarket today, and there wasn't a single person who didn't have on a mask, including the workers. Mm-hmm. And I was quite impressed. I see that people are not taking any chances, and that is the right thing to do. As we said, we are pushing this policy of personal responsibility. I know that there's some who argued against it, and they said that it will not work. But even though it's optional to wear a mask, people are still wearing a mask. In fact, one person said to me recently, or a couple of persons to that matter, said to me that the mask is like an appendage now. I mean, they do not feel complete without it. Mm-hmm. They're so accustomed to wearing it for the last 2 years. And again, it shows a level of responsibility, and we hope our people continue in that vein. The cabinet had to amend the policy. The health officials had access to keep the mask mandate in place for the hospital and for institutions, to include the prison, the Fines Institute, and to ensure that based on the vulnerabilities in those institutions, that we don't have any inadvertent spread of COVID. Even health practitioners, for example, they have access to maintain the requirement for masks, to wear a mask, to ensure that when they see the patients, that they're not exposed to contracting COVID. So we made that amendment last week, but save for that, and we're not accommodating any unvaccinated tourists. I would say that practically all of the restrictions have been lifted. So this notion about not having any choice, I mean, that is just utter nonsense. And seems as though the UPP, they were depending on that campaign slogan, if that's what it is, or campaign theme of not having the choice to be vaccinated or not to be vaccinated, or the choice to wear a mask or not to wear a mask. Well, let's see what they do, because the issue of choice does not arise. So that theme is obviously redundant.